We created this newborn Calf VIGOR score. What we ideally envisioned was for it to be a standard procedure for all newborn calves after birth, and then decide from there, based on that score, whether that calf needs further intervention to get them off to a better start and then hopefully lead to a more productive life.
If I come across a calf out in the field and I don't know what's going on, if that calf is not standing, even trying to nurse, we're going to get them in.
A lower vigor score is an indication that that calf is not well as it should be. What we based this off of was visual appearance, initiation of movement, general responsiveness, oxygenation, and then heart and respiration rates. The first one is visual appearance, so you're looking at meconium staining of that calf. Meconium is when the calf defecates inside the amniotic sac. It will get covered in this orange fluid, so you can easily visualize that on a newborn calf. If it's completely covered, that means it probably had a lot of stress during birth. Another criteria that we look at for visual appearance is swelling of the head and the tongue, as well as protruding of the tongue. So if the tongue's sticking out a little bit, or if it's swollen, if the head's really swollen, that can be an indication that the calf was in that birth canal for too long. The next criteria we're looking at is initiation of movement, really looking at how quickly that calf stands up after birth, indicating its vitality. So if the calf is really energetic, it's getting up quickly, it likely is good to go. If it's, lethargic, doesn't have a lot of energy, laying there, not willing to get up, then it probably needs further intervention. Another criteria that we look at is general responsiveness. Suckle reflex, you can just put your 2 fingers in the calf's mouth. Is the calf suckling strong or is it a weak reflex? We poke in the nasal cavity, so just grab a piece of straw, poke it in the nasal cavity. If there's a flinch or if the calf retracts its head quickly, it's an indication of good vitality. We also look at tongue pinch, so just grab the calf's tongue, pinch it. Does it retract the tongue? Does it not? Another criteria in general responsiveness is the eye, so touching the eye. If the calf blinks rapidly, indication of good vitality. If not, then it's probably pretty lethargic and not feeling well. So then we have oxygenation. We look at the color of the mucous membranes. So if it's a bright pink color, that's an indication of good oxygenation. And then if it's really dark blue or almost even a white color, it has low oxygen and can be an indication of hypoxia, which can also lead to a respiratory and metabolic acidosis. The next criteria we look at is heart and respiration rate. An easy way to look at heart rate, you just put your hand on the calf's chest, count the beats for 15 seconds and times that by 4. Ideally, you want it to be between 90 and 160 beats per minute. So respiration rate, you just look at the calf while it's lying down and count the breaths. Count it for 15 seconds again, times by 4. And then it should be around 40 to 70 breaths per minute. The most ideal score is around 25 to 27. That's a highly vigorous calf. If it's anything below around 20, 22, you're starting to get a little bit more concerned. I would say anything below 20, you would want to give them further intervention. There are several different interventions that you can do. Some of the standard ones are artificial respiration, oxygen, buffer therapy, warming the calf, getting colostrum into it as quickly as possible. A calf with a low vigor score, it most likely has a lot of pain and inflammation or acidosis. In order to deal with that pain and inflammation, one of the things we suggest is treating them with a non-steroidal anti-inflammatory drug, such as meloxicam.
There is definitely a payoff for getting that calf up and going, saving as many as we can. Things do happen, and we're just doing the best that brings in the most effective return.
Definitely early intervention is key in getting a positive outcome later on. You can prevent later issues and hopefully improve weight gain as well as productivity.